Hello, everyone. My name is Kelly Gartland, and I'm the Director of Sexual Assault Response Programs at the Indiana Coalition to End Sexual Assault. Thank you for taking a few moments to watch this video and reflect on SART Meeting Minutes. A little bit about me. I am a licensed clinical social worker. I've worked at the Coalition for about 4 years, and I have the privilege to work alongside folks who are supporting survivors directly every day. That is rape crisis centers, that's sexual assault service providers, it's the county sexual assault response teams that we're going to talk about today. Anyone who is in a capacity to be supporting survivors, ICESA wants to be here to help you. So my contact information is going to be at the end of this presentation. And if we can support your work, either in your local county sexual assault response team or anywhere else that you are working in support of survivors, we are here and available to help you. Our learning objectives for today. We are going to talk about the written meeting minutes for our sexual assault response teams. We're going to do an overview of what are meeting minutes, what should we be including in them, what should we be excluding from them, and why. What are the confidentiality expectations that we should be considering when we're documenting? And what are best practice considerations that we should be reviewing when preparing and approving minutes? I am not an attorney. I am a social worker. This is not legal advice. It's just some best practice guidance to help us all start thinking about what should we include and why. It's really, really important that in a multidisciplinary team like a sexual assault response team, we remember that each discipline has their own confidentiality expectations. The privilege expectations of our community-based victim advocates at a rape crisis center are going to be very different than the other disciplines on the team. That's also true for our healthcare partners. And so we have to be intentional about what sharing in a SART meeting, and that will show up in what information we are documenting and distributing from our SART meetings. So again, I am going to give some examples throughout my presentation. It is not to tell you that that is exactly what needs to be in your minutes or that those are the only things that you can include in your minutes, but it is to help us think about what information is important for us to document and why, and what information should not be included in our documentation or distributed along with our documentation. So what are minutes? Minutes are the official record of the meeting. It's the decisions, a documentation of the decisions that are made, action items, team accomplishments, system improvements, and accountability. Our minutes are designed to be a record of what was done at the meeting. It's not a transcription of what was said. Minutes are to document the work of the team, not the details of each case. Why do we record them? Minutes create a record for our team. They help us record the decisions that we've made, track our progress over time, provide continuity when team members change, demonstrate our accountability. It's an opportunity to write down what goals we're working on and the progress that we're making towards them, to create a record of the improvements that we've made in the system over time, and to keep members informed. We all know that multidisciplinary teams, you have members who have many, many demands on their plates. We know that too. And while we encourage you to be meeting on a regular basis, and we encourage full, robust attendance at every meeting, we know that not everyone can be there every single time. Minutes are an opportunity to keep each other informed and to pass along news from the meeting. So what are we going to include? Start with the basics. When was the meeting? Where did it happen? Who facilitated it? And who attended? Did we approve minutes from the meeting before? We're going to include agency updates. Are there relevant, applicable staff changes? Changes in services? Funding changes? Community outreach efforts, and aggregate statistics. If there is a new program in your community, we want to make sure everybody knows about that. If there is a reduction of services in your community, we want to make sure everyone knows that. The staffing and funding levels at everyone's organization change often. And the purpose of the SART is to make sure that survivors have as seamless of a process as possible. And if we send them to referrals for programs that don't exist anymore, that's problematic. If we send them out of the county to access service because we didn't understand that there was a new program inside our county that could have served them, that is also problematic. This is an opportunity for us to talk about what is happening at our organizations, what are the resources and services that are relevant for survivors, has there been a staffing or funding issue that would impact those things, if there is an upcoming community event that we want to encourage the SART to go to. Maybe it's Sexual Assault Awareness Month and we're going to plan a banner drop or a proclamation or an outreach event. Maybe it's back to school and we're going to plan a tabling event. These are all relevant pieces of information to include in your meeting minutes. And with the statistics, again, this is not individual case information. We're talking about community trends. So only de-identified statistics should be included, and they would be things like how many kits were done at the hospital this month, how many reports were filed with law enforcement. De-identified aggregate statistics are useful for your community and tracking trends. Systems level discussion. So the first bullet point on this is protocol revisions. Every SART is required to have a written protocol signed by your team. Our protocols are living documents. They are designed to be living documents because the resources in your community change over time, and our protocols need to be updated on a regular basis. Our protocols have 4 key purposes. It's an operational guide to establish the founding agencies. It's a reference guide during problem solving and conflict resolution. It's a resource when there are changes in the agencies or new administration has different ideas. And it's an important document for orienting and training new members. Our state is diverse and the services and resources across our state are diverse. And so while we do have specific questions that we are required to answer with our protocol, exactly how those questions are answered is going to depend on your community and what challenges you're facing and what resources you have. Protocol changes might include, our protocols are designed to answer lots of different questions. Who are the members of your team? What's the mission statement and the vision statement of your team? What are the expectations on SART members? What are the training expectations? What's our plan for supporting adult survivors who choose to report to law enforcement, and also for supporting survivors who choose not to? How do we protect confidentiality? What's the team's plan for collecting, preserving, securing, and destroying evidence? What's the protocol for working with minor survivors? Again, the answers to these questions are going to depend on your community and the resources that you have. And those answers are going to evolve over time. So as your protocol is revised, it's important that those updates be included in the meeting minutes to reflect changes in the system. That could look like things like changes in the referral process. If there are changes in forensic exam availability, hopefully, if you did not have SANEs working in your community, the revision is that there's a new program and you want to make sure that everyone in the community is aware of that. Unfortunately, sometimes there are programs that close. And then any gaps in resources or services that your team identifies that you are working towards resolving. And then what is our plan for working towards that? Decisions that are made. So we are going to document the decisions. Was the protocol approved? Did we reach a new interagency agreement? Is there a new training scheduled? Did we adopt a new form? Again, this is not an exhaustive list, but formal decisions that were made by your team can be documented in your meeting minutes. Action items. Did we identify a problem? What are we going to do about it? Who is taking responsibility for that? And what is the due date? We are documenting the decisions that were made, and the action items that we're working on. Now, what are we not going to document? To pause for a moment, confidentiality is very, very important in our SARTs. And as I started off with, every discipline is going to have different confidentiality expectations. In some of our more rural communities, it is pretty easy to identify different members of the community. So I have a list of survivor identifying information on the screen. We are not going to include names, date of birth, somebody's address, a phone number, or any information that could put them at risk. What I will say in that is that in some of our smaller or more rural communities, the amount of information that is needed to identify someone can be pretty limited. I have heard of examples of someone saying, there was a survivor that we worked with, and she recently immigrated from this country. In a really small town, that might be pretty easy to identify the person. I can imagine a scenario where someone would say, a mom came in with her, she has 7 kids. In a really small town, it might be pretty easy to identify that person. So think carefully about how we share things and how easy it is to identify a survivor, because it's really important that we protect their privacy. We are not going to include any kind of protected or privileged information. Again, every discipline is going to have their own confidentiality expectations, particularly for the folks working in advocacy spaces and healthcare spaces. There are very significant consequences for them if they do not follow the rules regarding confidentiality. I work in the advocacy space largely, and for our rape crisis centers and our sexual assault response programs, the funding streams that support their programming has really strict confidentiality expectations written into the funding streams. And so while I understand the desire to really openly communicate information, we do not want to jeopardize services for the broader community by sharing information that we do not have authorization to share and documenting and distributing that information in any way. So please be thoughtful about any information that is protected or privileged by confidentiality laws. We would not include confidential communication between a survivor and their advocate, protected health information, or any other information that is restricted by privacy laws or court orders. We also want to be thoughtful about security sensitive information. Shelter locations are often confidential, especially domestic violence shelters, for the safety of those who work and are staying inside the shelter. If a survivor has written a safety plan with an advocate, that information and the confidentiality of that information is really important in maintaining their safety. And so we just want to think about, could disclosing this information put a survivor or anybody else at risk, and be very careful not to document things that would. We do not want to include graphic descriptions of cases, witness statements, investigative details, medical findings. Again, the SART meeting minutes are about documenting the way the system responds, not the details of each case. It's important that our meeting minutes do not include opinions and speculations. Our meetings, actually, we need to be careful not to be including our opinions and speculations, but it's additionally important that those things aren't showing up in our meeting minutes. So we would not share or include in our meeting minutes any assumptions about credibility, rumors or information that has not been verified, or personal judgments about survivors, suspects, or other professionals. And then arguments. Multidisciplinary teams, by design, bring together people from lots of different fields of work and lots of different perspectives. They are designed to help us get together and collaborate. And sometimes that process can be a little messy. When we bring differences of opinions to the table, sometimes we have to argue our way, hopefully in a collaborative, constructive way. But sometimes we have to work together and share our opinions, and those are going to differ until we come to a decision that makes sense for our community. We are going to document the decision, not the process of getting to the decision, the actual decision. What protocol update did we determine needs to be made? The decision gets documented, not the process of hashing it out. And why does this all matter? Why am I recording a training to talk to you about what to include and what not to include? Our minutes are a record over time of what our teams are working on. They're for us internally, but it's important that we're thinking about the fact that they are a written record and they're shared out. Writing careful minutes helps us to protect survivors' privacy, protect our partnered agencies, demonstrate accountability for our team, encourage collaboration between the members, and focus on improvements over time. Confidentiality laws and privilege laws do protect information for survivors, but it's not a guarantee that every single portion of your minutes is going to remain confidential for forever. So, writing careful minutes helps us protect survivors further. Thank you very much for your time today. I appreciate that you are taking time to thoughtfully write minutes for your team. I know that being a SART coordinator is not the only responsibility on your plate, and taking time to document carefully is really important. If we can be of assistance to you here at ICESA, my contact information is on the screen. If you would like to have a more detailed conversation or have us review some minutes and give you some feedback, please reach out to me. We are happy to help. We know your plates are full, and we are really, really grateful for the work that you are doing to improve the system for survivors in your community.